Hello, guys. How are you? Good evening. And we are actually going to go past this particular slides once again, just because we started recording now. Okay. Um, Sorry. Okay. So back to introduction of counseling. We are again going to look at the objectives. We're going to start describing the concept of counseling, defining the counseling psychology, what counseling psychology is. We're going to explain the differences between counseling and guidance, and also we're going to explain the difference between counseling and psychotherapy. We're going to explain the roles and the characteristics that a counselor plays, and we're going to describe the personal and academic qualifications that a trainer and the training required by a counselor. And also, we're going to look into what a trainee psychologist needs when during the process of their internship or when they start working. Okay, and then we're going to finally analyze the roles and values in counseling. So, what a counselor is any professionally trained person who is trained in these particular aspects of counseling, psychology, social work, nursing, and has specializations in areas such as vocational counseling, rehabilitation counseling, educational, substance abuse, marriage, relationships, or family counseling, and so on. So, what this counselor does is they provide evaluations, informations, and other things needed to maintain a healthy mental status. Right? They give the client the ability to solve their problems. They help support the client in order to make their decisions. As in, when the client wants to make certain decisions, and they are in counseling or therapy, the counselor provides them the support that is required for the person to make the decisions themselves. They also help uh, the client reach their goal, reach their uh, desired attitude or behavior. Counseling is a professional assistance with for people with personal problems, including stuff like emotional, behavioral, vocational, marital, educational, rehabilitation, and life stage, which means people even with retirement problems, even in their later stages of life, that is your geriatric problems. All these are also taken care of by a counselor in the process of counseling. Counselors make use of techniques such as active listening, guidance, advices, discussions, clarifications, and also administering tests and assessments, which help the clients achieve what they've come for. Right? They've come to counseling for a certain reason, and those certain reasons, that is their goals, are achieved with the help of the counselor. And I
Vasudha,
believe
are
that
you on the
yesterday
next
we
slide?
yes.
We are still on
Yes, I
introduction.
am on the next. Okay, is that so? Let me just check. Yeah, that seems to be a little slow. Yeah, now it's come on to counseling. I think it's a little slow by the time it changes the slide, so please bear with me. Okay, and now we talk about what counseling actually focuses upon. It helps the client in developing their mental health. It helps prevention of mental health problems. It talks about the growth of a person in growth of a person. That can be their personality, their perception, and the way they think about different stuff. Redemption is trying to get over their past life in case they want to do that, in cases of PTSD and self sabotage and stuff like that. So the techniques, uh, okay, the techniques that counselors use. Sorry, the techniques that the counselors use are active listening, guidance, advice, discussion, clarification, and administration of tests, as we've previously discussed. I'm so sorry if the slide is not changing. It looks to be a network issue.
Vasudha,
Okay.
just one, kind of, I don't know, correction or what I can call it. Counselors usually don't give advice, right? So
Okay.
they help you to explore the pros and cons, and the solutions come from the counselee or the client. So counselors stay away from giving advice as far as possible, right? In fact, they're not
Okay.
supposed to be giving advice. Okay.
Okay. Okay. So I will definitely take out advice from this list. Okay. I'm so sorry that the slide doesn't seem to be changing. I will be posting this PPT afterwards. Definitions that are given by the ACA and the APA state that there are some common factors that are there in the definition of counseling. So basically, no matter who defines counseling or the process of counseling, you'll find these certain points to be common among all of these definitions. First and foremost, counseling is a profession and it deals with personal, social, vocational empowerment, and educational concerns of a client. And it is conducted with people who are considered to work within the normal range. That is, you cannot work with someone who is extremely, extremely intelligent, and you do not work with people who are definitely on the disabled side, mentally disabled side. You work with people who have normal range of emotions and mental issues. All right. Then it is an extremely
Vasudha,
theory
another
based.
another thing. I
Yeah.
just wanted to pitch in before we move in.
Sure, sure.
I don't think that's the the correct way of saying that highly intelligent people don't need counseling with a higher
No,
IQ.
no, that is not
Everybody
what I
needs
mean.
counseling. No, no. The
Exactly.
normal range also includes the people with high IQ. So absolutely, that's not the thing. So what this essentially means is people who have mental illnesses or disorders are
Okay,
not
okay, okay,
really, counseling only. Counseling doesn't help them. They need a clinical intervention. But definitely,
okay.
people with high IQ. In fact, we are seeing in the corporate world more and more that they need a lot of counseling. IITNs,
Of course.
IIM and all. I've seen in my whatever experience, they need a lot of counseling because EQ is what
Lot
is
of
the
counseling.
thing. So yeah, so they come under normal
Emotional
for
quotient,
sure.
yeah. Okay.
Definitely, it comes under
So
emotional.
then it
It's
was,
just the
then
disorders
it
which are out
is
of
a my
this.
mistake.
No
Okay.
problems. No
Thank
worries.
you so much,
Just
Seema.
wanted to
I
clarify.
sorry. Thank you for correcting me. Uh, and thank you for correcting me so much. So, as Seema said, people with who require clinical diagnoses are not people who we work with. We work with people who require counseling more than clinical aspects, as in clinical diagnoses. Then we move on to the theory-based next point, which means that counseling is a theory-based subject, and it takes place in a very structured environment in a structured setting. So the steps that we take in the process of counseling are neatly structured by our predecessors, so that we can counsel people with ease. Ease in the sense, in a much more structured and a proper way, which leads to higher rate of success. Clients learn how to make their decisions, as in they come to us if they're in a state of confusion, and if there is in a state of dilemma, they come to us, and we as counselors provide them with all that is required in order to help them make their own decisions. Clients learn to formulate new behaviors, feelings, and thinkings that we've discussed previously also. A client who comes in with a maladaptive behavior or a negative form of thinking, or core beliefs that are not healthy for that person, we help them come out of it and form new behaviors and with that feelings and thinking. Then we encompass the various subspecialties as well. Counseling also takes care of the other various subspecialties as well. We move on to guidance. What is guidance? Guidance is a direction and advice. As Seema said, advice doesn't really help, I guess, here. I guess it's a direction and counseling provided in cooperation to the client or the recipient, who often, okay. We use personal data here in order to give them their direction and counseling with the help of interviews and auxiliary tests. So, this person named Biswalo in the year 1996 defined that uh, guidance is a term that is used to denote the process of helping an individual gain something called as self understanding and self direction, and also help him or her make self decisions so that they can adjust themselves in areas such as homes, schools, and community environments. So there are
Vasudha,
certain differences. Yes,
I
Seema.
was talking about not giving advice in counseling, but guidance
Counseling. Okay.
does have advice. Yeah, this is for
Okay.
guidance. So guidance has
Okay. Okay.
advice. Yeah.
All right. Thank you so much, Seema. Uh, Thank you for correcting me. And we move on to the differences between guidance and counseling. Guidance is there to provide leadership, supervision, direction, and professional guidance for the future. Whereas counseling is talking about a solution to a problem that the client comes in with. Guidance is pre-problem, whereas counseling is generally post-problem. Guidance shows you something that you do not know. It is telling you something that you do not know. Suppose a child who's in their college years, I mean, plus one, plus two comes to you and be like, I do not know what to do. I like both science and arts. I do not know which way to go. Then we take in few tests and then we tell them this is how your future is if you go in this way. I mean, this is how your future might look like if you go this way. Might look like if you go that way. It is up to you as to what you decide. Whereas counseling is more facilitative listening and questioning that allows the client to choose the best solution for the problem he's come in with. As in, he's come in with a problem, he'll listen to himself speak out loud. You will add in a few points that you know, give him some insight into the problem that he is having, and then he is allowed to make the decision. Or no, he's not allowed to make the decision. He or she makes the decision for themselves. All we give him is all we guide him, or all we show him are the different ways he can think in order to reach to the options that he or she has. Guidance provides a direction, advice, and counseling by using personal data. But counseling is more remedial in nature, and it aims at helping people deal with the problems and conflicts that are facing in their lives. Characteristics of guidance. Guidance is
Vasudha,
a very
one second.
conscious.
Vasudha, sorry,
Sure, sure,
another point I had to make. In
sure.
general, counseling in general is talking about helping the person to resolve their issues, right? But it is not
Yeah.
necessary that it is post problem. For example, if you're talking
Okay.
about pre-marriage counseling, see, you don't have a problem there. You
Ah.
don't come with an issue. You're actually coming to a counselor to
Yes.
figure out what kind of a life partner you want. So it's not completely right to say that it is only post problem, or if a person is in problem that he needs counseling. So counseling can also be true in case a person wants to work on themselves for their growth, for understanding themselves better, for their self awareness. So counseling comes in handy there also. So that is what I just wanted to
Okay.
add.
Thank you
So it
so much
says
for the extra
remedial, right?
information.
It's not really
Yes.
remedial in all the cases, right? Like I told you,
Okay.
pre-marriage counseling, there's nothing remedial right there. They're just coming to figure out who
Yes,
they
it
are
is
and what
more.
kind of a
Yeah.
partner they want. That's also counseling.
Sure. Sure. Okay. Thank you so much. So I think there are a few changes that our textbook definitely needs to do. Okay, let's move on to the characteristics of guidance. Guidance is generally a continuous process, and it's a positive program that helps people meet their needs irrespective of their stage of life. As I said previously, suppose my father has just retired and he doesn't know what to do. He doesn't know if he has to take up gardening, trekking, or if he has to go back to another job. He'll come in for guidance, and someone or the other who is guiding him, who is telling him or showing him the path, will tell him, "Sir, you love to teach. Please go into the field of teaching. They need professors like you," and stuff like that. Okay, right? So the next point is it is both generalized and specialized service. As Sunita last time said, generalized is about is like basically anyone who is not even trained can give them an advice or a direction, right? Just by looking at the person or knowing the sorry, smallest information about them or even a little information about them, they'll be able to give an advice or a suggestion saying that, okay, you can go this way. So, suppose, for example, before I took up hotel management, I was a little confused as to what to do. I loved cooking at that point of time. My father gave me an advice as to going into hotel management, and I actually found it very helpful and useful, and I did my hotel management. So this is a very generalized kind of a advice. But when we're going to specialized services, like Sunita said again, Mala, the person who gave us a guest lecture a long time ago, she spoke about the different types of the opportunities that are there. She told spoke about the different types of careers that are there and how we can choose to go into the particular career that we want and things like that. That is the most specialized service which needs trained people. Generalized might not require trained people. It can happen with even your parents, your family, your friends, and stuff like that, and people like that. It involves, okay, guidance is the characteristics of guidance. The next point, it involves providing information and research activities. So basically, if you go to anyone and you say that you have a confusion between the two directions that you want to take, anyone, the first thing that they say is try finding more information. Try doing a little more research on the options that you have. The more information that you have, the easier it is for you to select which path to take. That is what this particular point means. Information, it is information oriented and addresses the developmental issues. So basically, whatever information you're getting during your research activity talks about the pros and cons of this particular direction that you've chosen, and it is easier for you to understand. The guidance is also done appropriately, accordingly. Psychotherapy. Psychotherapy is any psychological service provided by a trained professional that primarily uses forms of communication and interaction to assess and understand and diagnose, to treat dysfunctional emotional reactions, or to change the ways of thinking, to help with the behavioral patterns and things like that. Psychotherapy is a general term that is used to describe the process of treating psychological disorders, mental distress through the use of verbal and psychological techniques. So things like CBT, DBT, Rogerian, all these come under psychotherapy. So let's focus on the differences between counseling and psychotherapy. So psychotherapy generally focuses on recurrent problems and things that have been existing since a person's childhood. That means you'll have to dig real deep into the person's life in order to be able to help them correct or move towards their goal. Whereas counseling is more the recent kind of a problems that has come up. For example, if the person has just gone through a breakup, then we'll try to understand what the problem of the breakup is, or we'll try to fix the emotion that they're going through at at that point of the breakup. Psychotherapy in the time of a breakup will look at the sorry. If the person is going in for psychotherapy, the person for this breakup issue, the psychotherapist will go deep into the person's problems and find out why actually the breakup happened. Count Seema, is that correct? Seema?
Sorry, I didn't hear the last part, Vasudha.
Okay, no. I was just saying that counseling will generally looks after the feelings that the person has after the breakup, whereas psychotherapy tries to find why the breakup actually happened, and if there is any you know, childhood kind of trauma that happened in order for the breakup to happen now.
Yeah. No, no. Even counseling goes into a in depth, but counseling is more a sort of a temporary kind of a problem. Which generally the person is okay in all domains. It's one domain that is concerning. Like the other day, I was talking about study. Not able to study, not able to focus and concentrate.
Yeah.
But psychotherapies will have to go really, really in depth, because it could be a very core belief system that is saying that I'm a failure, and then we have to go deeper, which means we go to the childhood and all of that. So this is a very deep seated concern that is addressed in psychotherapy, whereas counseling could be any day to day. I want to switch my job. Can I, should I leave? I'm very upset that my husband has this issue, something like that. So it's more something that is bothering the person now, here and now, that kind of a thing. So counseling is that, right? I hope I've
Yeah,
made it
okay.
clear. Yeah, yeah.
Yeah. Thank you so much. So let's move on to the next points of counseling and psychotherapy. So counseling is more specific, is more in sorry, is more specific in nature. It talks about specific situations and behaviors, whereas, as Seema said, psychotherapy is an all-over pattern, big picture oriented kind of a thing. Counseling generally is short term, which means that it moves from about 6 months, 6 weeks to 6 months, whereas long term therapy is a little more, it'll take a long time, as in few years. It could take longer than few years also. uh, Counseling is more focused on actions and behaviors, whereas psychotherapy is more focused on your feelings and experiences. Counseling uses things like techniques like talk therapy, whereas psychotherapy uses techniques like CBT, in DBT, Rogerian, and stuff that we've spoken about before, or techniques that we've spoken about before. Counseling, a part of counseling is, okay, it does say guidance, but since we've previously discussed, guidance may not be an appropriate word. So counseling is a support and education that is given to a person in order to help them find themselves and find their own solutions to the problems that they're having. Psychotherapy, in-depth focus, it is an in-depth focus on the internal thoughts and feelings, core issues, and which leads to personal growth. That means it has a change in the personality as well. Counseling is generally a secondary process, whereas psychotherapy is a primary process. Let's move on to the
Vasudha,
four
just
major categories. Yes.
another addition, I mean, to this. Usually, yes, it's a
Sure.
long-term therapy. I mean, psychotherapy takes longer, but not in all the situations. For example, in cognitive behavior therapy, CBT, which also goes into your core belief system and all that, it takes between let's say around 15 sessions, 10 to 15 sessions or 20 sessions. So it's not really true that all types of psychotherapies take years together or something like that. So these are in general that they have talked about, but let's not take it like psychotherapy means years together and this means a few months. It's not like that. Sometimes counseling can be like
Okay.
a 1 or 2 session thing also. So that's how it is.
Yeah.
Yeah, go on, Vasudha.
Thank you so much, Seema. So, with all the information Seema has given us, let's move into the four different types of, or four major categories of psychotherapy. The first one is psychodynamic psychotherapy. Basically, psychodynamic therapy is an approach which involves the facilitation of a deeper understanding of a person's emotion or other mental processes that take place within them. It works to help people gain greater insight into themselves and make them understand how they feel and how they are thinking. So generally, here what the person does is he's thinking about something, he's feeling a certain way. They just do not know why and how they're feeling and why and how they're thinking that particular way. So psychodynamic therapy helps them understand the feelings that they're having. They'll make them have the counselors or the psychotherapists make them see as to what is causing this feeling or this particular pattern of thinking. Next comes cognitive or behavior therapy. This is a type of psychotherapeutic treatment that helps people learn how to identify and change any destructive and disturbing thought patterns, as in maladaptive behaviors that they have, which are actually having a very negative influence on the way they're thinking, the way they're behaving, and the way they're feeling. Next comes the humanistic approach. This is the third type of psychotherapy. It is a mental approach that emphasizes the importance of being true to yourself in to make sure that you're leading a more fulfilling life. Suppose, say, that Mr. X is like, no, I love this banking job. It is so amazing and all that. This is just an example again. Uh, the person has a banking job and he might not be really happy with it, but he's like, no, I'm getting a very I'm getting a very good salary, I'm getting a very good pay, so I'm very happy with it. No, he's lying to himself. He wants to be a musician. He'll go try out being a musician when he's true to himself. So the minute he's like, he comes to terms with his own mind, he'll be able to find that happiness and fulfillment in his life. Next, we move on to the fourth and final category of psychotherapy. It is called integrative therapy. Integrative therapy is an approach to an approach to treatment that involves selecting different techniques from different therapeutic orientations that is suited to the client's particular problem. It is more a tailor-made or custom-fit therapy kind of a thing. It is done by okay. By tailoring the therapy to the individual, the integrative therapist hopes to produce a more significant result. So here, what it is basically it's almost like taking your clothes to a tailor. The tailor takes your measurement, cuts out the dress and cuts out the cloth and stitches it to you, stitches it and presents it to you. The minute you wear it, you'll be like, oh, this is so amazing. I feel so much better. It is exactly how integrative therapy works. All the therapy methods and techniques are custom fit and tailor made to the client.
Right. Vasudha,
Therapy,
again, for
yeah.
integrated, I think also called eclectic, because you can choose, for example, if you're working with the client and you're using the humanistic approach, right? But you find that in spite of coming for several sessions, the person's thought process has not changed. There is a deeper issue there. So then you realize that maybe the person, of course, needs a psychiatric help, plus maybe a CBT, cognitive behavior therapy, to change the thought, the entire cognitive distortion. So that is in the hands of a therapist or a counselor. And that is why, it's a very important thing to understand different types of therapies and practice it, because according to the client, you can mold it, you can switch from one to the other, or you can use multiple this thing for it. So that is the integrated therapy that we are talking about here.
Okay. Thank you so much, Seema. Okay, I'm not going to keep thanking you over and over again for every information that you're giving. I'll thank you in the end for all the information. Uh, okay. With the information again that Seema has given us, let's move on to psychotherapy's emphasis. What it emphasizes on more, the present. The psychotherapy emphasizes on the present more. Okay, and it talks about insight. It is very much dependent on the insight that the person has. So yeah, it'll dig deeper in order for you to have that kind of insight. uh, Seema, I do not understand this particular word or the set of words it says. Psychotherapy emphasizes more on detachment of the therapist. I was hoping
The
to
word
find more
detachment.
information from you on that. Yes.
The word detachment, yeah, it is very important for the. Actually, I can't see your next slide. I'm still on the integrative and
Oh, okay.
humanistic.
I am
So,
sorry.
right.
Slow network
So,
connections.
so while the counselor
Yeah.
or the therapist, all right, now I can see. Right. So, detachment of the therapist is very important, because we will learn these terms like transference and counter transference. What happens is, if you're working with a client, and let's say the client has a teenager, and the client is talking about the teenager. Now you also have a teenager, and the client is telling you how the kid has got into drugs and all of that. Now you also have, as a counselor, a teenager, and you start feeling, oh my god, now what happens, maybe I'm also leaving my son alone at home. I hope he's not up to something. So you are also, basically, there is a transference happens when it is happening from the client side, and counter transference happens when it is happening from the counselor's side. So this should not happen. You should have a very detached approach, a very professional approach, wherein the whole session is about the counselee or the client, right? So their problems, you don't start now, mixing it up with your own problems as a counselor. So you have to practice a lot of
Okay.
detachment, and it's a very deep process, which
Okay.
we'll
Okay.
talk about when we look at the process of counseling in the next chapter. So detachment
Of
is the
course.
key
Of
word. You
course.
have to be detached from your client. Otherwise, the counseling
Of course.
session is not at all effective. In fact, it's counterproductive.
Success rate, success rate would fall. So, as Seema said, detachment of the therapist is emphasized upon by psychotherapy. Now, the therapist's role here is as the expert. So, the therapist is the person who has the information on how to get the client to reach their goal. It is where he is the expert, or he or she is the expert, and helps guide or helps the client to get to where he wants to be or she wants to be. So there are certain hallmarks of a counselor, as in how a counselor should be or what a counselor should know. So first of all, it is again talking about the definition of counselors, which says that the counselor is an individual who is professionally trained, and the counseling areas that he or she should be proficient in or should know information about are vocational, rehabilitation, educational, substance abuse, marriage and relationships, and family relationships, and also have information on who, sorry, should be trained in psychology and social work. There are certain expectations that we have from a counselor. These expectations are what will determine the success rate of the counseling process. So, we would like professional evaluations from the counselor, information, suggestions. I'm so sorry, the slide hasn't moved. Okay. Um, so, I will go ahead.
Vasudha, just
Yeah,
to add to your slide on how a counselor should be well equipped with all these areas, plus the entire lifespan, right? Right from, they should
exactly.
know
Yeah,
the issues of children, teenagers, young adults, marriage, midlife crisis, elderly, palliative care, grief
geriatric. Yeah.
counseling. So all types of counseling is, the more you equip with yourself. That's the reason why we have lifespan in first year, because you need to understand the mental state and emotional state of every stage of life. And as a counselor, all that is also important.
Yes. Thank you so much. Uh, yes. As Seema said, if the counselor should be the extremely knowledgeable person in any given room, right? They should know almost every information or how to deal with every information that has happened from childhood till the last stage of life. Okay. We shall move on to the expectations from the counselor. So, again, the counselor's professional evaluations are important. The information that the counselor has is needed. Suggestions, all of us need suggestions from a counselor. The counselor's enhanced abilities, as in things like active listening, reading in between the lines, trying to look at your what do you call it, non-verbal and verbal cues that the person gives. All these are enhanced abilities that the counselor develops over time. The problem solving skills that a counselor has is extremely expected out of a counselor. uh, they have to help make decisions, they have to help the client achieve desired changes in attitude and behavior. They must be able to identify any negative thinking. The assist this a counselor must assist the client in making progress in their relationship with others, and also help the client recognize any maladaptive behaviors that the client might have. They must be aware of the theories of personalities. They must be aware of abnormal personalities and multicultural issues. Characteristics of counselors, this is something that every counselor must have. All right, the counseling requires an understanding, sorry the count sorry counseling requires an understanding of self and a detailed awareness of the impact that one person has on other. So other skills that a counselor requires is, as I said, active listening skills. They must be able to recognize the levels of empathy. They should keep an open mind. They must refrain from any judgmental responses. They have to be in tune with the client's emotions, as in they should be able to understand the client's emotions and try to be in tune with those emotions. They must have a counselor must have the ability to negotiate and problem solve. They must show moderation in self disclosure. So, when it comes to the process of counseling, self disclosure is extremely important, but the time, the place, and how the counselor self discloses is going to affect the counseling process. Understanding, the counselor must understand the complexity of communication, and they should have again the ability to pick up on both verbal and non-verbal cues, as I was just saying. They must use paralinguistics judicially. I would want Seema to actually shed light on this use of linguistics. May I know what that means?
I really have no idea. This is the first time I'm reading that term. So we'll look at that a little later.
Okay,
But one thing I
definitely,
wanted to
definitely.
add here in the ability to show moderation and self disclosure, I think this is, they are talking about self disclosure of a counselor. Because sometimes the
Yes,
client gets very curious and starts asking you, okay, ma'am, what about you? How many children do you have? Where do you stay? So I think that is a very, it's
yes,
very tricky because you just cannot say, no, I don't want to disclose anything about myself. But at the same time, you have to, so it's, there's a technique of doing that, very
of course.
whatever, a more, yeah, sensitive way of doing it. So I think we'll look at
Yes.
it later.
So,
This paralinguistics, I'll get back to
exactly.
you if I understand this. Yeah.
Definitely, definitely, definitely. So we shall move on to the next slide. These are continuations of the characteristics that you want in a counselor. So the counselor must possess assertiveness and the ability to confront the client in case it is necessary. Then the counselor must be competent. They must be a competent communicator, and they must have this ability to self-monitor. So one thing here is competent communicators. There are so many competent communicators, like your politicians, like those sales people who come in, right? All these people are competent in communication, but the thing is, there's a difference between the competent communication that we do as counselors and the competent communications that they do as salespeople, politicians, and all that. So we will come back to that in a little bit. We shall move on. So the counselor must possess self-awareness. So they should be self-aware. So even the personality of the counselor does affect the counseling process. The way the counselor carries himself also has an effect on the, what do you say, the client, right? If the client, if the counselor is not aware of the way they're portraying themselves or with the way they're carrying themselves in front of the client, it does affect your client. A counselor must model the desired behavior of the client. So suppose the client wants to be more self-confident. The counselor must show what self-confidence might look like or must look like in order for the client to understand and try doing it the same way. They must maintain confidentiality. So No counselor can ever give out information about a client to anyone. Okay. And the major thing is the counselor must have empathy. The counselor must have empathy. Then credibility through honesty and consistency. So basically, credibility of honesty and consistency is a kind of a test that the client puts towards the counselor. So your credibility lies on the honesty and consistency that you have towards your client. The Definitely the last two topics, sorry, the last two lines state that the person must be good at crisis management and must be unbiased. So the counselor must have these two abilities, that is crisis management and being unbiased. Crisis management is extremely important because it's almost all the time that the client comes to you, they are looking for crisis management, because counseling in here in India is almost like that only. It's almost a crisis management. And unbiased, you should not have any kind of bias. Suppose it's a teenager coming to you, and as Seema said previously, you have a teenager, you can't be biased towards the parent. And if the parent is coming in for counseling, you can't always support them, right? And things like that. So let's move on to the educational qualification. As the okay, the picture is not shown yet, sorry. The major thing that a major qualification that a psychologist needs is a master's degree. That's all that is required in order to be a psychologist. But in certain cases, your licensing also comes into picture. That licensing bit we shall look into a little bit later. We shall look into the education and the training that is required by a counselor, both the person who is a professional counselor and who is a trainee counselor or trainee therapist. All right. So the first things first, the abilities that a professional counselor or a therapist need. These are the stuff that they need. The ability to explain the micro skills. The micro skills are all those non-verbal cues that they give. Just a second. Yeah. So the non-verbal, sorry, the micro skills are listening, non-verbal communication, silence, empathy, responding, summarizing, and all these things come under your micro skills. It is very important that the counselor has the ability to explain these micro skills. The skills needed to commence the counseling process are also extremely important. You cannot just randomly start your counseling process. There are certain methods that you need to follow in order to give it a very smooth start. Interpretation of nonverbal and minimal responses. So, in case you're asking an open-ended question to your client and they come up with a no answer or very minimal response like yeah, maybe, okay, and stuff like that, then you need to be able to understand what it might mean. Demonstration, sorry, the counselor must demonstrate any reflection of content and feeling. They must display appropriateness of content and feeling during the counseling process. As in, if the content is a little uneasy to the counselor, they must keep a straight face, right? They must be able to keep a straight face during the counseling process. And they must be able to develop different questioning techniques and also know the risks of these questioning techniques. Suppose the client develops a really amazing questioning technique but does not understand the risk of it. So suppose the counselor is trying to question the person who is about to, okay, who's coming for suicide prevention, and the questionnaire is in a triggering format. It shouldn't end up making the person who's coming in with suicide thoughts want to actually kill himself after the session. It should be in such a way that it calms them down and brings the thought away, right? So the questioning techniques and their risks both must be understood. uh, Challenging self-sabotaging beliefs. So a counselor must definitely challenge a self-sabotage belief that a client has. So the counselor must also reassure the client for a better psychological well-being. The client must be feeling comfortable when the client comes to the counselor. The counselor must have the ability to effectively terminate the counseling session and address dependency. So counseling process is not a 1 day or a 2 day process, right? It's a period of time. It's a really huge period of time. Even if it is few weeks, it is a great amount of time. And when this amount of time you're spending so much time with this counselor, or the client is spending so much time with the counselor or the therapist, they tend to start depending on the therapist or the counselor after a period of time. So this dependency of the client must be addressed and made sure that it does not affect the client after the end of your counseling session or your therapy sessions. That is after the end of the entire process. And let's move on to the characteristics or information or the types, or what do you call it, the training required for your student trainees. First and foremost, they must be able to report any observation that they have done. It can be uh, what do you say, just a second. Yeah. So any observation that is during the counseling process, whatever they have simulated or whatever is real, whatever may be the observation, it must be reported to the counselor who is in charge. They must identify the techniques that are there. So any technique, any trip, trick or technique or any kind of an information that is given to the client, in case it is useful for another person, that is things like your halt and stuff like that, all these techniques can be used with other people as well, right? So these techniques must be identified and they must be understood. So if any trainee facing difficulties, if there's any trainee facing difficulties, they must speak up to the counselor who they're training under, in order to sort out this issue and go further. And they should find why self disclosure is difficult. Okay, they should the reasons why self closure is difficult. Again, as Seema said, if the client comes in and starts asking questions like how many children do you have, are you married, and all these sort of stuff, no, all these sort of questions, you should understand why you can't give all these information, because the person might confuse their state of mind and your state of mind, and it might end up being a whole different khichdi altogether. So they must also understand the risks of self disclosure. If you're giving a client certain information about yourself, it must be in such a way that it is helpful for the client towards a build sorry, in building a better future, not making it worse. So the student trainee must be able to sorry, discuss modeling of as a form of counseling. That is, remember when we said that the counselor must be able to demonstrate the kind of emotion or feeling that the person needs to see. So this can be discussed between the trainee and the counselor in order to help the client evaluate any verbal and non-verbal communication. So again, as a student trainee who is in the presence of a professional counselor, they might not be able to get pick on verbal and non-verbal cues, but as they are trained by the counselor, they slowly start to evaluate what those verbal and non-verbal cues are, figuring out the counselor's role. So, how does the counselor come into the picture during this counseling process or the therapy process? That is what the student must understand. They must practice active listening. They must understand the importance of non-verbal response. So, non-verbal response may be shutting of eyes, lifting of an eyebrow, or even trying to crack your knuckles in the session. All these things are non-verbal responses in some form or the other. So, understanding what it actually portrays to the client is important. The student trainee must also report discussion of minor problems that they're facing, either what the client is facing or what they are facing during the learning process. Both, they must be able to paraphrase. They must understand what paraphrasing is and how to use this paraphrasing. They also should know the difference between confusion and catharsis. So, catharsis is when you realize, ki, okay, this is what is happening. Confusion is not knowing what it is. Identifying examples and reflecting back to them. So, here, using examples or identifying examples is important, because if you have an example that can help a counselor help the client, it is important that you inform or give the counselor the example that you have. Observing and demonstrating various responses to various open and close ended questions, as well as comparing the client's answers. So, when suppose, say you're taking an assessment to various people of the same sample or the similar group. Suppose you have an assessment that you have to take it for college students. You're gonna compare the answers that they give amongst the open and the close-ended questions, and then you'll compare these things and find out whatever that you are trying to find out. Okay, I might not be very clear in this. So, Seema, can you kindly
Vasudha,
give the
yeah,
information
yeah.
on this? Yeah,
Vasudha, if you want, I can just quickly take you through this slide. I think we have about
yes,
10
please.
minutes or so, and we
Sure.
have another few topics to cover. I think we should complete this chapter today, right? So, what do you say?
Yes, yes, yes.
So,
Please
can I
do,
just
please do.
try with this slide? You also must be
Sure,
tired.
sure, sure.
So basically, here we are
Yes.
talking about the trainee, right? The trainee, how observant the trainee should be, and continuously you need to keep discussing with the counselor, the person, the trained counselor. So here, you have to be very when you are under training, you have to take care of all these things, observing, demonstrating various responses to. So there are open ended questions, there are closed ended questions. It's better to avoid asking closed ended questions, which means yes no answers, because you won't get much from the client, right? So you have to be very careful in understanding how the whole process takes place as a trainee. Identify the risks of too many questions. It should not look like an interview. If you are a counselor, that doesn't mean you just go on. So trainees initially, what happens is you end up asking a lot of questions from the counselee. The idea should be to just stick to open ended questions, and maximum talking should be done by the client or the counselee, right? Avoid questions beginning with why. Yeah, go on asking why this, why that, why. It can be very annoying, it can be very intruding and probing. If you continuously keep on asking why do you think, people say that we keep on asking why questions, that's not really a great idea as a counselor. So these are the things as a trainer you are supposed to be careful about and watch very closely in a counseling session if you're an observer, right? Use micro skills like Vasudha was saying, question, paraphrasing, listening, empathy, all those. What is going on between, let's say, you are an observer as a trainee, and there is a counseling session going on in front of you. There is a senior counselor and a client. These are the things you need to observe. What are those micro skills that the counselor is using? How is he using listening, empathy, reflective questions, and all of that? Come up with appropriate examples for confrontation. See, confrontation is the last resort. After everything is tried out, confrontation happens. So that is not real. Usually, as a counselor, you never confront a counselee as a rule. But when you're seeing that there is nothing that is moving ahead, you have to get to confrontation. And so there is a way of doing that. Again, this observer, the trainee, is sitting and observing all this and continuously talking to his counselor after the session, that this is what I observed, this is how it is. Find chief elements of good confrontation and appropriate use of confrontation. Yeah, again, the same point. Practice reframing, correct? Paraphrasing, or asking, summarizing. All those are techniques. So these are the things which have to be really practiced very well as a counselor. Develop a method to identify the existence of self-destructive behavior in both individuals and groups. Yeah, so you should be able to, a lot of times if there's a group counseling session going on, one particular person, a client, can really try to sway the idea of the entire group into a direction. So you have to be very careful as a counselor how you kind of get everything together and make sure that you're not diverting or digressing from the whole topic being discussed. So all these things should be kept in mind as a trainee. Ability to explain and provide precautions when using normalization. All right, I don't quite get this. Vasudha, you want to add something to this?
So basically, normalization, even I'm not really sure, but I will definitely get back to it. I will
Sure,
definitely get back to
sure.
you in the
Yeah, I
next
think we'll
this one,
understand this.
because
Yeah, let's move
normalization,
on.
I think, is a coping mechanism, right? It is definitely a coping mechanism that we
Oh, I
that
see. Okay,
clients use,
okay.
and providing precautions against normalizing is like, maybe I'm guessing, I'm just guessing, that when a person is trying to normalize something that has happened to them, that is, oh, this is just regular, this is very normal for me to have to fall down and then break a leg or something, just an example. We're going
Maybe,
to
yeah,
try
this
to
is
tell
talking about
them that no,
generalization. Oh, yeah, this happens to
generalization, yeah,
everybody,
normalization,
that kind of a thing.
yeah,
Quite
this
possible.
happens to everybody,
Oh,
kind
okay,
of
no,
thing.
this is not something so difficult. This happened to my neighbor also. This happened to something. So maybe that is what this
Exactly,
means.
exactly,
It's okay. We
something,
can
maybe that
always
is
come
what it
back to
means.
this point, I think. Right? We
Definitely,
can move on,
definitely,
Vasudha.
definitely.
Yeah, yeah. Thanks.
Yes, yes, yes. Okay, I don't think the slide is changed. Um, okay, so yeah, Seema, the slides changed.
Oh, there are more, is it? So all this the trainee has to do.
Yeah, there are
Ability
so
to
many.
respond and
There are
find
33
optional.
if I don't remember, if I remember.
Oh, is it? Okay. Okay, fine. Good pointers as a trainee. So basically, ability to respond and find optional responses to difficult dilemmas. So yeah, the person has to see. You cannot be stuck in a counseling session. Now, what do I do next? So you have to have a lot of different types of responses. See, every time you're asking an open-ended question to to a client, you need to think of different aspects of the client's life, right? So don't keep on asking repeated questions. There should always be more options there, so that the responses, the person really thinks deeper and comes out, the client thinks deeper. Ability to explain the circle of awareness and applications. I think let's just run through this and see one or two points that are relevant right now. Ability to explain the
Yeah, sure.
circle of awareness and application. Maybe how much the person is self-aware, and how the person is probably in a day-to-day life applying those things, whatever the person is talking about. Maybe keep a keen eye on all those things. Understand and explain psychological blockages and how to overcome them. Now this is very important. You will see a pattern when you're doing a counseling session. There are certain, the person says, no, I just cannot do this. So what are those blockages? Very important to identify those as as a counselor. Describe steps taken by counselor to
Okay,
help client
I
achieve
think I
their
have an
desired.
example here. I think I have an example here. Psychological blockages. So there is I've seen a person who's blocked the advances of the counselor. Advances in the sense, if they're trying to break open a bombshell to them and say, like, see, this is what it is and this is why you're feeling this way, the person blocks it off and says, no, I'm feeling better by holding on to this, because I do not know what I would do if I let go of this.
Right, right. A lot of defense mechanism and all. I think we will go in depth
Yeah,
into it. People come with their biases, with their blockages, with so they just don't move ahead because they think there's no other
exactly.
solution. So very important as a trainee to identify those blockages. Describe steps taken by counselor to help client achieve their desired goals. Very important. Again, goal setting should start only after catharsis happens. So those are the things we'll look at, in depth later. Identification of interdependency in observed relationship and explain need for time management. Very important. Again, your counseling sessions you have to start probably winding up. If it's a 45-minute counseling session, by 30 minutes you have to use the techniques of winding up the session, and knowing the difference between terminating the session and counseling process and compare them. Yeah, so how do you end the session and how do you end the entire process? When do you think the person is ready to now stop coming for counseling? Usually the client himself or herself decides when they have to stop coming. So there is a different routine, a session, and the whole process of counseling. It can take 1 month, it can take 2 months, I mean it can take a few sessions. So that's how. Yeah,
Yeah,
places where you can apply
yeah,
these attained skills. Yeah. So all these
yeah.
places, yeah, I
So,
think we missed one point here, demonstrating the dangers of client counselor
yeah,
interdependency.
I'm
I
so
think again that
sorry.
is talking about transference and counter transference. Again, it's a very important
Yes,
concept. We'll look in depth a little bit later in this. So now these are the places where you can apply your skills when you're talking about family counseling, family support services. You can, so as a counselor you can work in all these places and many more. Family counseling, NGOs, government agencies, community health centers, outreach services. Outreach meaning you actually go to villages and all that. Vasudha, just go back, no? Outreach
yeah,
is when you go to maybe government schools or different other places. Women health centers, counseling you young and young children, youth and children, family therapy, substance abuse support groups, so and counseling at work, even at corporates. So there are these yeah, there are like some I think wherever there are human beings, counseling is required. The next slide that you were
exactly. Yeah,
showing, actually, which I shared with you, those are the places
yeah,
counselors are required, right from schools, colleges. You can be a career counselor, you can be an assessor, you can be an educational counselor. See why the education and career and all that, why do you need to be a counselor? Because you also need to understand the emotional level of that person, the emotional quotient of that person. So children with special needs, yeah, again that needs a lot of counseling, not just for the children but also the parents, siblings, and all other significant adults. And consumer psychology, very important. All these Amazons and Swiggies and all that, how do you think they attract? So you can be a psychologist there. You can do a lot of stuff in consumer psychology, product development, and trend survey, economic assessment, planning. See, psychology is what understanding the human behavior, right? So you can use your counseling skills in all these areas and many more. Industrial workers, in terms of developing welfare schemes. Even in welfare schemes, you need a lot of psychology. You need to understand group dynamics and everything. Clinical psychologists, actually you can work in a clinical setup also, where obviously the doctor doesn't have that kind of a time to sit with every patient and talk. Most of them need a lot of emotional counseling. That's again where we people can pitch in. Actually, these are all the job opportunities we all have, right? Home for the mentally ill, physically disabled, trauma victims. Now here, other than the patients, there is an entire family which is which needs a lot of counseling. Caregivers of the patients need a lot of counseling again. Drug and alcohol de-addiction centers, sports academies, or practicing as independent clinical psychologists. You can set up your own counseling centers. Then human resource, HR professionals, of course, industrial, the other psychologists are there.
psychology
But
in
if you
the
want to do
OB.
counseling, OB, but then OB is only at an HR level. Again, from
Yeah,
employee to employee, you need counselors. So again, we can also work in corporates and do individual counseling. Then juvenile and all these correctional. I think, yeah, wherever you have these kind of places, no, where there are underage people who have committed crimes and all, there also you can work. Data analytics, so many. I mean, we can just share this list, so you can go through it.
yeah.
Marital counseling and military. Yeah, many of the counselors are working in the Indian Army. In the In fact, just last week I got a ad for Indian Air Force. They're looking for counselors. So right from NGOs to animal psychology, corporate social responsibility, CSR work, to life skills training, to disaster management. Basically, wherever human beings are, there counselors are required. So that is where we all are required, right? Yeah. So we can move on, Vasudha. Uh, so it's a
Yeah,
very
sure.
positive thing for each one of us. Actually, we have a huge, huge scope ahead of us.
Yes,
Anything else is
definitely.
left in this chapter?
Yes, there are about five, four, three slides left.
Okay, let's just quickly go through
Three
that
sides
so
exactly.
that we can
So
close that. Yeah.
yeah, it's not moving ahead. The presentation is not going ahead as it's not presenting anymore, I guess.
What's left now?
Just a
The
second.
license, is it?
License, yeah,
Yeah.
him. Licensing,
Right. So,
again, it's a
license.
very. Go ahead, Seema, go ahead.
No, so here again, I noticed when I was just skimming through the thing, these licenses and all, they've just copy pasted from some other country, some other states, and all that. They said
Exactly.
requirements are based on state, occupational specialization, and work setting. School in some states need the school counseling certificate. Some only need master's degree, while others need both counseling and teaching certificate. License board in India is the RCI, the Rehabilitation Council of India. They also provide services for licensing. Is in another slide for license?
Actually, no, there is so much in the
Okay.
textbook
Okay, but I want
because
to,
I do
yeah,
not
I
want
mean,
to
there is,
copy and paste. Yeah,
correct, correct. No, I want to quickly add here, there's a lot of stuff in the textbook
sure.
which is obviously being copied and pasted. You can run through that, I mean, just read the whole thing. But the crux of the matter is in India, counseling as such, counseling psychologists or we people, we do not need licenses. We
Needed
just do
license.
not
Yeah.
need licenses. We can open our own centers. We can work in all sorts of establishments, whatever we listed down. So in India, as of now, there is no license at all that is required to practice as a counselor. The only thing that you require a license for is if you are working as a clinical psychologist or a clinical, you don't have counselor, psychologist, for which you have to do an MPhil and other things which we had, which
Yeah.
Charan had taken us through. So they need the license because they are working with the, mentally challenged people. But we
Challenged.
people, we counseling psychology people, we don't need license as of now. There is no such rule in India. So yeah, I think we can move on. Well, you can read up. There's a lot of other stuff which is
Yes.
given in the textbook. It's actually quite irrelevant for us. Right. Just go on.
Yes. So there are only
Yeah,
two more slides
Seema,
left. Bear with
I would
this.
like to add one thing that they have mentioned RCI and
Right.
quite a lot, and it says that if you're counseling any person with disability, then you
Right.
need an RCI license.
Correct.
That's the
Correct. That's
only
not
gist
for
of
us.
whole.
Correct.
Yes.
That's not for us. That's why it's not for us. It is for clinical people who have taken clinical psychology. If they
No, no,
want to,
anybody, if you're dealing with a person who has a disability and you're counseling,
correct, correct,
then
correct,
legally
Shivani.
you need a license. You
Correct,
can
Shivani.
counsel. Yeah.
Correct. Because
So that is
the
that is
three streams
exactly
we are
what
talking
Seema is
about,
saying. No.
what I'm saying is that if that was the case, if you want to work with the, like we were talking about the normal, the people who have an emotional issue, why we have taken counseling psychology is because we want to work with people who are normal and who have emotional issues. But if you actually want to work in a hospital setup and work with, let's say, bipolar, schizophrenia, and the clinical side of it, then you need a lot more, not just the license, but you really need to upskill yourself with a lot of, you have to first take up
Yeah.
MA psychology
Clinical
in
psychology.
clinical psychology. You have to go ahead, study further, take up an RCI license, do more
Around
courses,
6 years
probably
more.
do an MPhil. So there's a lot of, then you are a proper full-fledged psychologist. Yeah. But here for counseling, you don't need any of that. You don't even need an RCI license. Okay. So we'll come back to this
Oi,
point
chup,
later. We'll quickly just finish
chup.
this chapter. Counselor and the values.
Hello.
Vasudha? Yeah.
Yeah, yeah, yeah. I'm right here.
Hello.
So
Yeah, hello.
yes,
I just have a
these.
sorry.
Sure, sure. Go ahead,
Sorry.
go
I
ahead,
just
go
Satya,
ahead.
have a
Satya, can
yeah.
we just complete this slide and finish the lesson so that whoever wants to leave can leave and then
Oh,
we can
sorry.
take it
Okay.
forward? Is that okay?
Okay. Yeah, yeah,
I
sure.
am so
Yeah, yeah.
sorry.
So,
Scooby is
Vasudha, go ahead.
barking at me for God knows what reason. If you can hear someone bark, it was my Scooby. I'm sorry for him.
If you
Okay,
want, I can take
counselors
this
and
up.
values. Sure, please.
Yeah. So, counselors and the values, it is important to understand that both counselor and client carry very different value system. So, at no point
Inika
of
Rasna.
time, your value system should clash in a counseling session. So, you really, really have to work a lot on being non-judgmental. That is very important as a counselor. Every value system contains an inherent conflict or contradiction when exposed causes high level of anxiety. Yeah, exactly. Because you cannot have very strong belief. Suppose a lesbian comes and for counseling and all that, you will say, oh my god, no, this is not my cup of tea, or somebody. So you have to be very, very careful and very open minded and totally non-judgmental when. So that is your ethic of a as a counselor. The client's value system during the process is challenged. Of course, that's something that should never be done. And counselor must be able to step into the client's shoes. Yes, empathy, that is very important. You really, really need to be extremely empathetic. Otherwise, the client will never come back to you if he thinks that you are just faking it or pretending to be empathetic, but you're not. Must be non-judgmental and unbiased. Number one quality of a counselor is to be totally non-judgmental. Accept people for who they are. So that is very, very important. Counselor must keep a tab on their energy and desire to help. That's very important, both ways. Definitely you should have a desire to help, but never go overboard. People will start sending you messages at 12 at night and all of that. I'm suicidal and this is what's happening, I'm going through a panic attack. You really must know how to detach. You really must know to what extent and how to help people, because ultimately you're helping them. To And again, that's what role modeling is. We kept talking about modeling. You have to model yourself also in a way that the client is very clear about what he can and what he cannot do. Counselor must be persuasive, similar to a salesperson and politician. I don't know, but yeah, basically, I think more than that, you have to be very genuine, and you should have that thing of reaching out to people. I think they're talking about this because you need to be having the convincing capacity. That is very important. So, Vasudha, you can move on. See, if you're not
Yeah, there
convincing
is
people,
one
why will
last.
people listen to you? That is the whole thing.
Exactly.
Anything
So
else, Vasudha?
there's one more slide. There is one more slide.
Right,
Seema again seems to have stuck. Okay,
sure.
this is one last slide. It is again the continuation of counselor and value. Sorry, counselors and their values. So a counselor must possess certain traits and qualities, and these certain traits and qualities are tolerance, acceptance, and respect for an individual. So again, it comes under the thing of keeping tab on their energy and stuff. Communication and counseling require knowledge and some basic understanding of the action based techniques, right? So you cannot just communicate randomly. Just like last week, Sunita and Seema said that the information that you give, no matter how great your vocabulary is, it is supposed to be like butter and not like a knife, right? It is not supposed to break the heart of a person. It is just supposed to smoothly bring them to the place that they have to be. You cannot be very harsh. Like, for example, there was something that's saying challenging the client's behavioral aspect or perception. We cannot challenge that directly. That has to be done through questioning and stuff like that, which does not make it look like as though you're trying to do something dramatic or drastic. Information and knowledge that a counselor has, the skill that a counselor has must feel like a warm hug that protects the client, and it should not be like a bandage that is ripped off, or a cast that is being taken off from a broken leg, right? A counselor has ethical values that affect the communicator sorry that effective communicators do not have. So there are certain ethics that and values that we have that generally are not available in a salesperson or a politician, that I've mentioned in the previous slide. And that brings us to the end of our chapter. Thank you.
Also, this is again
Just
a
wait for it
very
to show up.
shoddy cut copy job. They have tried to compare salesmen with
Yeah.
counselors, which is
Okay.
very sad. But
So
anyway,
I'll do
right, you
one
can
thing. I'll
stop.
stop the recording.
Yeah, yeah, please do that. Yeah.
Just a second.
Right. So those of you who want to leave